technical conversations. How do you all feel that Indonesia is doing? Are you feeling generally quite positive? I know, as you said, it's become something that now no politician in Indonesia could ever run against BPJS.
Right.
It would be impossible. But how are you all feeling as to how this is going?
Of course, I was, happy, and it was, exciting.
Right.
But at the same time, now I'm also worried. I'm worried, especially, for the deficit. And if now we have to wait the time, if too long, then there will be problem. And I'm worried if the problem cannot be solved because too deep and too far. But actually, if now, and we can tackle the problem, and especially actually we know what is the problems and how to solve the problem. But again, also the problems, very few people who realize the real problem.
So let me then ask one specific question. Indonesia is a country that under Suharto developed a complete national primary healthcare system, the Puskesmas system, that was actually tremendously important in developing, but it was focused almost exclusively on maternal and child health care. And I would say there are some parts of the world in which just developing primary health care is important, but in parts of Southeast Asia, primary health care was developed now and has been very, very successful in reducing both infant mortality and even maternal mortality. But suddenly, now, the primary healthcare system is being asked to do tasks it never did before, to deal with mental health, to deal with tuberculosis, to deal with heart disease, to do real triage, etc., often with physicians who have, and with a whole healthcare system that was not designed primarily to do that kind of work. It seems to me that there's now a tremendous challenge in building the competence at the primary healthcare level to serve this whole system.
Yeah, I think you are right. It is really challenged because now this system is really rely on the primary healthcare. In fact, the primary healthcare was not designed to solve all the problems.
Right.
Suddenly, again, like the psychiatric diseases should be solved in the primary healthcare. In fact, Indonesia now, the doctor or primary healthcare physician have to able to solve 155 diagnoses. In fact, in the medical schools, not yet matching of that, because that time it was not again designed. It should be only for promotion, prevention, and some mild diseases. But so again, I think it is challenge, and now we are developing primary healthcare curriculum and primary healthcare study programs to keep up with the need and development in the new tasks of primary healthcare centers.
I think it is a big challenge. When I used to go to the primary healthcare centers, 5 years ago, very often the number of patients seen per day was fairly low, although still often doctors would only spend 5 to 10 minutes with a patient. Every primary healthcare center I've gone to in the last year say that their numbers of patients have doubled or tripled within these 5 years, because in order to enter the system, you have to enter at the primary healthcare level. So I think it's just a very big challenge to build up the primary healthcare side of this.
So you're right, but again, because primary healthcare now is responsibility of the local government. But many local government are not really aware of the new task. So the local government, at least by law, have to allocate at least 10% of the local government budget. But unfortunately, not all the local government allocated this amount of money for health sectors. So this is again another challenge.
Right.
So is it possible that someone could run for office against this system?
I think so.
Yeah, I don't think while it's a wonderful system, but when people hit the financial deficit, then anyway, I would like to hear you speak a bit about how you see mental health care, and perhaps we could add a little bit to that being covered by this as well, and whether or not you see it working well.
Yeah, I think by regulation, by law, because we are developing comprehensive coverage, so psychiatric diseases or psychiatric patients actually are covered. But in the reality, there is little bit problems because you know, the psychiatrist is not placed in the primary healthcare, but of course in the you know, psychiatric hospitals. But psychiatric hospitals, the number are limited. So again, in the reality, in the practice, it is sometimes a little bit problem. So we call it not effective coverage. But in some area, for example, like Jogja, the Department of Social Affairs, they are, you know, tackle the problems. But of course, because the background is not medical science, sometimes a little bit difficult for them.
So let's open for questions. I know there are people here who are from the School of Public Health who are very involved in this. So first, yeah.
Thank you. My name is Nani. I actually have two questions for Professor Ali Ghufron. Thank you for the presentation. It is very enlightening to me. The first one is about the behavioral health treatment. One of the things that I learned when I came here, which I think is not yet existent in Indonesia, is that here most, if not all, insurance plans cover behavioral health services like smoking cessation services, weight reduction, and so on, which I think is very important because you mentioned earlier that Indonesia is facing a deficit issue, and we know that the top 10 diseases, the top 10 death-causing diseases, most likely are chronic diseases which are related to behavioral health issues. Is Indonesia going that way, or?
Yeah, I think it is not done by BPJS or health insurance, but actually done by Ministry of Health and district health office. But of course, Minister of Health and district office have limited. So they are now, for example, like trying to register a type of you know, healthy behavior. So how many people are smokers, and then they are following and trying to change the behavior. But again, it's not done by health insurance scheme, but it is by Ministry of Health and the district health office.